Good morning. I'm Suzanne McGurn, the President and CEO of Canada's Drug Agency. Bonjour tout le monde, je suis Suzanne McGurn, la PDG de l'Agence des Médicaments du Canada. On behalf of everyone, I would like to welcome you to our 2024 Symposium. Au nom de toute l'équipe, je vous souhaite la bienvenue au Symposium 2024. To start today off, I'm pleased to introduce Elder Jenny Tedesco, who will open our symposium today. She is a proud Anishinaabe Algonquin Kokum from Kitigan-Zibi, Anishinaabe, a community north of Ottawa in Quebec. Jenny is a residential school survivor and a retired child and youth worker who has dedicated her life to working with Anishinaabe children and youth. In her career, Jenny has focused on teaching special needs children and sharing her knowledge of Anishinaabe Algonquin culture, teachings, and language. Jenny firmly believes in the strength and the resiliency of First Nations, Inuit, and Métis people, and we are honored to have her here today. Kwei, Jenny.
Just a reminder for protocol, there'll be no videos or photography of the smudging ceremony. And if anyone has any respiratory or discomfort with smudging, just a heads up that this smudging will happen in the first row. Thank you.
Thank you so much, Kokum Jenny, for that opening. We're grateful to have you with us here today.
So we smudge this morning to begin our day in a good way. And when we do individual smudging, we smudge all over our whole body, our eyes, so we continue to see good things, our ears to hear good things today, and our mouth to continue saying positive things and having good thoughts. So I'm going to begin our prayer in my language. Kishimanado, Migwechonje Aki. Migwechonje Kizis, Kagisasage Jonje Ninwin Nongom. Migwechonje Kakina Kaiton Winishishing. Kizis to be Kizis, Kayanangushag. Migwechonje Nesewin Kamijian Kijimino Bimadazian. Migwechonje Wensisak, Kabamodejig, Kanewakadejig, Kapamisuijig, Kaye Majmerijig. Migwechonje Nibi, Kakana, Kaiton Wenishishing, Zibing, Minkwan. Migwechonje Nushomasak, Nikokamisag, Kakanani Dodemag. Widoka Wishin Kitchene Bakayon. Widoka Yakazajig, Shawanem Nibojig, Gedamakazajig, Ewa Wisanajig. Migwechonje Awensisak, Kabimodejig, Kanem Kadajig, Kadamik Miselojig, Kaye Majamewajig. Migwechonje Kakana Dokaninwag, Unje Tanizig, Unje Nongum, Unje Kakana Pimarazijig. Mie Gichimigwech, Migwech. Kwei, so Jenny Tanas, Bakshat Tanas Kunadishnikas, Kitakanzi Bini Donjaba. Minuendam, Denis Yanon Jeno, Mamaway Kakina Awayeg. As stated before, as Suzanne said, I'm a residential school survivor who was taken from my home when I was 6 years old. I was put on a train here in Ottawa after I traveled 2 hours to get to the city of Ottawa from my community. I was a sick child when I was put on a train, and I traveled on a train for 3 days to get to Kenora, Ontario. The trains were slow at that time, and I guess I was kind of lucky to have my sister with me while we were on the train. And when we got there, we were immediately separated, and because she was in high school and I was going into grade 1. So I didn't see her too often, maybe only at Christmas during that first school year. But I got through it, and I came home. I was one of the lucky ones that came home. And now with the work that's being done to find the little graves, I think of them all the time. But I did come home and continued school in the provincial school, where I once again dealt with racism. And but when I finished my education, I received my diploma for early childhood education in a child and youth worker program, and went back to my community to work with my people. I worked in a school for 11 years with a special needs student. I taught her sign language. When she left the school, that was when I retired, when I was 70. So my goal when I retired was to educate educators, professionals, and about the history of Anishinaabe people and how important it is for us to be here and to talk about, what was done, and but also to work together and to invite people back to our community to see, what Anishinaabe people need to have to make life more bearable. Because right now I still have bottled water in my own house in 2024, and this is something that should have been taken care of. And because reconciliation, I have a hard time with that word because of the water that we still have to drink out of a bottle. I know communities that live right beside a dam, and they have to use a generator to have light in their own house in 2024. So it's still a long ways before we really have reconciliation. Many Indigenous communities lack the understanding of the impact of prescription pills, the addiction and the roller coaster of moving from pill to pill. Although I'm grateful that we do have the drugs that will help people through various diseases. Right now I'm praying for a member of my family who has cancer, who has to take morphine every 4 hours, and which we had, I forgot the name of it, but anyways, it keeps her calm, and and it takes care of the pain. So I'm grateful that she has that drug to use. But a blend of modern medicine and traditional healing or traditional practice is what some doctors are realizing is what works best for our people. We need to go back to our medicines, and a lot of people are, but we still need some of the drugs that we get from the drugstore. It is important to make connections and to build bridges so we can understand each other. Miigwech. Thank you.
Miigwech Kokum Jenny, thank you again. We really appreciate your participation today. Now I have the pleasure to introduce the Federal Minister of Health, Minister Mark Holland, who will be joining us live but virtually to say a few words. Please welcome Minister Holland.
Thank you so much for having me. I wish I could be with you there in person, although you may not wish that. I have a cold, as is going around. But I really want to take an opportunity to thank the leadership of the Canadian Drug Agency and to recognize how important this symposium is at a very critical moment in our health system. We, of course, spent a lot of time in Parliament debating the early stages of national pharmacare, and the Canadian Drug Agency is going to play an absolutely critical role in developing that. But I thought maybe I'd take just a moment to talk about what that is and some of the things that are facing us, and then to touch upon the essential role that I know you'll be playing as we move forward here. In the first order, it is very difficult to go and have conversations with doctors and nurses who have patients in front of them, who they can give advice to of what they need to do to manage their illness, who can't follow that advice. Talking to a doctor about diabetes patients who come in and are told what they need to do to manage their diabetes, and yet they can't afford that medication, means that they're going to get much sicker. Unfortunately, we know that could lead to amputation or could lead to a myriad of other chronic disease and illness. So creating drugs that are affordable, ensuring that all Canadians can afford drugs, is absolutely critical. C'est certain pour moi que absolument essentiel partout au pays que toutes les personnes peuvent accéder à le médicament et le médicament est abordable pour leur vie. Le coût pour ça, pour une situation pas comme ça, c'est absolument énorme. And let's look at the cost. I mean, it's not just the social cost of somebody in front of us who can't get their medication. It's the cost to our system overall. We're starting with diabetes and contraceptives. Diabetes costs our health system somewhere around $30 billion. And that's going up over the next number of years to something close to $40 billion. We're on an escalator that we can't sustain. And the answer isn't to wait for people to get into crisis and to deal with it, but to be upstream. And that's why we have to be there with drugs. Now, the part of it is just enormously complicated, as you know, and the role that the Canadian Drug Agency will play in providing Canadians with the trust that this can be done and to make sure that it's done properly is critically important. I want to just recognize a couple of things that are essential within that. One of them is the appropriate use strategy. Another thing that I see as I go across the country is the number of seniors who are regularly use at least one inappropriately prescribed medication. It's estimated about 1.9 million seniors. Each year, there's about $419 million spent on potentially harmful prescription drugs, and about $1.4 billion spent on the effects. Developing an appropriate use strategy will help healthcare workers and make sure that Canadians get better care, and that's absolutely critical. So that work you're going to do is so important, and we want to work collaboratively with you. On bulk purchasing, we've already been able to make huge reductions by working to purchase pharmaceuticals together, and it's a critical way of being able to do that. And by being able to develop a national bulk purchasing strategy, I think the Canadian Drug Agency is going to be able to see even further savings in the critical medications that the Canadians rely on every single day. One of the things that came up through the discussions in pharmacare is looking at the fact that Canada has a patchwork drug coverage system, over 100 public drug plans with thousands of private plans. So about 100 public plans rather, and thousands of private plans. So by developing a national formulary, the Canadian Drug Agency is going to help make sure Canadians, regardless of where they are, regardless of their income, can get their medication. That formulary is going to be essential in laying the foundation for further work on pharmacare. And looking at pharmacare, I know right now we're headed towards the Senate. We're hoping in Kim Pate, who's the sponsor, we're going to be able to get out of the Senate in about early October. We're having really positive conversations with provinces. We're not waiting. We want to make sure that these drugs are flowing because I think we're going to be able to show in diabetes and with contraceptives how powerful it is when people have access to the medication that they need. What that means in terms of social justice and their freedom to be able to, in the case of sexual health, have control and autonomy over their own body. In the case of diabetes, to be able to manage their disease and be able to live a life free from worsening chronic illness. And then set the foundation and prove that we can do this for the whole country. Because I think fundamentally it is about the kind of country we want to live in. It makes sense of the advent of our healthcare system that pharmaceuticals were not included. They played a very minor role in health. That is not the case today. And no one in this country should be dying of something that is preventable. Sometimes folks say to me, well, that costs a lot. Why would we be doing it? We don't ask that when we have somebody that we love who's cancer. We don't ask how much it's going to cost us. We make sure that they get the care that they need. Fundamentally, it's about the kind of society that we want to live in, where all of our neighbors have access to the care and treatment that they need to be well. And it's part of an overall strategy to make sure that we're upstream. It's not what I'm here to talk about today, but what we're doing with dental care, with more than 500,000 Canadians having already received care. What we're doing with a national school food program. What we're doing in primary care with the deals that we struck with provinces. Overall, we need to adapt to a health system that is faced with extraordinary challenges. And when people don't have access to drugs, why would they come in for primary care? Why would they come and have that conversation with their doctor when they know the answer is going to be too expensive for them to explore? So I want to say to the Canadian Drug Agency, the work you do is so critical at this important time where we're beginning to lay the foundation for something much different to make sure that everybody has access to the affordable drugs that they need for their health. And I wish that I could have been with you there in person, but I look forward to working with you as we take these steps, important steps forward to this essential change to our health system. Thank you so much.
Thank you so much, Minister Holland, for joining us today. Merci. One step in our organization's reconciliation journey is to have our land acknowledgement translated into Algonquin and Anishinaabe language. This is new for us, and as an organization, we'll work to learn and give this land acknowledgement ourselves in the future. I have a new language learning goal to work on. It's not Victoria's role as an Indigenous person to give the land acknowledgement, but she has graciously offered to provide it today as it is in her mother tongue. I'd like to invite Victoria Tanasco Comanda, who is a strategic partner, Indigenous engagement and partnerships here at Canada's Drug Agency, to share it out loud for the first time ever.
Kwe kakina miigwech kabijaye gondaje nongum onje nedom tawanan. Kida naki wene nang mashkiki nanagada wabandanig o wabandanawa Anishinaabe aki. Tabakina wewen ashij kakina Anishinaabe anuj wenjabajig was aki wednong wenjabajig ashij abtawazijig tanaki wenan. Kakina tanaki wenan Anishinaabe kagige ashij kiabaj nongum. Ka akana maganewe nanj mamawe waya bishkiwejig o mashkim widokazawin kine nisutadayang kakina mamawe kiwa wena bemin kichi wabandaming kakina kabe dodaganawejig Anishinaabe on dandanaki wenenang miigwech.
You have your task cut out to teach me that. I'm speaking to you today from Ottawa, located on the traditional and unceded territory of the Algonquin Anishinaabe Nation. Thank you to the Algonquin peoples who have been the keepers and stewards of this land for thousands of years and over many generations. People are joining us today from various locations, and I'd like to encourage all of you to always think about where you live, work, and play, and to take a moment to acknowledge the people who have traditionally occupied, sustained, and continue to care for the land you call home. Before I begin my formal remarks today, we're going to play a brief video.
We're delighted to announce the official launch of Canada's Drug Agency. Nous sommes ravis d'annoncer le lancement officiel de l'Agence des médicaments du Canada. As Canada's drug agency, our goal is to work collectively and move the needle on creating a connected and effective pharmaceutical system and to enable modern healthcare systems through evidence. This is how we will contribute to better care for all. We're expanding on our existing evidence mandate, which spans drugs, health technologies, and health system interventions. This includes new focus areas, like improving appropriate prescribing and use of medications, increasing collection and access to drug data, and enhancing system coordination and alignment. We're working with governments, the life sciences industry, patient groups, Indigenous organizations and communities, clinicians, and other health technology assessment producers within Canada and internationally to leverage our collective expertise. Together, we will chart a path toward a brighter future in healthcare in Canada.
As the video shows, we look a little bit different than we did last year, but we also look a lot the same. Today marks a new beginning for our organization as Canada's Drug Agency. As part of that, our revised brand, developed internally, builds on our past, leveraging our previous color and shape. And for those of you who may not be aware, the shape is a nod to the imperfect nature of evidence. As some of you may have heard at yesterday's session, even our logo may be a bit disruptive. This is paired with the changes that recognize our evolution to build and enhance how we meet our current mandate while embracing new opportunities for the organization as reflected in the tagline. We've also moved to a fully bilingual logo, so you should hear me say not just CDA, but CDA-AMC. Our current strategic plan has led us on this journey, and we'll continue on this path to evolve the work we do to meet the new mandate. This symposium has long been a space for sharing knowledge, furthering excellence in evidence and HTA, and most importantly, building connections across the health and pharmaceutical ecosystem. With this year's theme, From Disruption to Opportunity, Embracing Change in Healthcare, I cannot think of a better place to begin our next chapter. While the Government of Canada announced Canada's Drug Agency in December of 2023, our journey to this moment started long before that. Our expanded role and mandate are a testament to the valuable work this organization produces and the trust that we've earned from our partners. Our organization was identified as a natural fit for Canada's Drug Agency. It builds on the strength of our organization while expanding on our role in the pharmaceutical space. As you likely know, there are already many players in this space, and we do need to work differently and more collaboratively towards a common goal, and I'll elaborate on that a little bit more. Rest assured, however, that we will continue our important work that includes drugs, medical devices, clinical interventions, and evidence to support health system decision makers. These are the types of pieces of work that people have come to rely on, and we'll continue to do them with the same quality that you expect, while expanding in other areas to help improve the pharmaceutical ecosystem. But we can't talk about where we're going without acknowledging where we've come from and what's led us here. This year marks our 35th anniversary since we were established in 1989 by the federal, provincial, and territorial governments. This organization started as the Canadian Coordinating Office for Health Technology Assessment, COTA, and some of you may remember or even have been part of it. Its creation was an important step in the advancement of evidence-based decision-making. We've developed a strong reputation as an essential organization that provides Canada's health system leaders with independent evidence and advice so they can make informed decisions about drugs, other health technologies, and health system decisions. Throughout our organizational journey, we've embraced change to make sure we're meeting the needs of our partners and staying ahead of the curve when it comes to health system change. Right now, we are in a period of substantial change and disruption in the delivery of healthcare across Canada and around the world. Our organization's current strategic plan was created with this course of change in mind, to anticipate emerging needs and trends innovate to help our partners adapt and thrive in a changing landscape, and ultimately to help transform health systems. Many of you today listening may have been involved or witnessed these changes. For example, we are involving patients in new ways, including as part of our board of directors, improving time to access medications through collaborative initiatives like Target Zero and time-limited recommendations. At the same time, we're upholding the principles that underpin our organization with inclusion, diversity, equity, and accessibility, and decolonization, among others. Now, as Canada's drug agency, we are well positioned to help improve our pharmaceutical system amidst the changes in our health system, while emphasizing our commitment to continuous improvement and innovation. And for those of you who were here yesterday participating in workshops, I hope you could feel that as part of the presentations. Our health system is rapidly evolving. We know we need to be agile to address the demands of the future. Significant disruptors will change healthcare in the next 5 years, or sooner, as we heard yesterday. From artificial intelligence to data sharing laws and regulation, to changes in technology that allow for more personalized medicine. The accelerated pace of innovation for technologies in our health system has never been greater. So how do we not only keep up with, but stay ahead of the curve on these changes? From our organization's perspective, we've already started in developing our next strategic plan. We have spoken with many people, hopefully a number of you in the audience today, about what you would like to see from us. Where are your priorities? And how should we set our direction for the next few years? These valuable insights from you, our partners, will help guide our future actions and set us up for success. So thank you for your contributions. As Canada's drug agency, we'll strengthen our convener role to bring the various parts of the pharmaceutical system together to address challenges we see in the system and to make benefit from the opportunities we also know are available in the system, while we continue to deliver the high-quality evidence that our partners depend on. There are significant opportunities to improve our systems through better alignment and cooperation across players in the system, and you're going to hear more about that shortly. In times of significant change, we have a choice in how we move forward. At the end of the day, it's not about a new agency or a new name. It's about the impact on people across Canada and what can we do to make it better. If we can inform better practices around appropriate prescribing so someone can avoid an adverse event, that is success. I'm out of pages, Julie, with apologies. If it's medicines to get people, I actually know the ending. If it's medicines getting to patients faster, that's success. If it's us being able to find new ways to work together, that's success. By this time at our next symposium, what I hope to be able to stand up here and say is to be able to give a litany of those things that we've done together that have made successes, that patients will be able to see they've gotten medicines faster, that we've been able to improve our processes to answer the questions that people have always had about how we do our work. And at the end of the day, for people to look at Canada as a leader in how we manage pharmaceuticals from bench to bedside. So thank you very much. And at this point, I would like to call up our panel who will be joining us for the first plenary session.